My name is Janine Chivitate. I'm the Deputy Director here at the UN Development Program's Global Centre for Technology, Innovation and Sustainable Development here in Singapore. Before we get into all of the great speakers that are going to be talking to you from private sector companies in both Singapore and the UK. They have some really interesting and impactful innovations that have been helping support local response and recovery efforts for COVID-19. So just before we get there, I want to talk with you guys a little bit about how Global Centre is involved in supporting similar efforts. So Global Centre here is part of the United Nations Development Program, as I just mentioned, and it's really focused on how we leverage tech, innovation, and digital solutions to help the countries we work in on the ground. So our three main areas under that chapeau that we work in are future cities, sustainable and digital agriculture, and sustainable finance. So we're actually working with a lot of startups and SMEs with solutions in agri-tech, health tech, digital services, and others to help support our field offices to tackle their development challenges. So a couple of initiatives briefly just to mention where we've been working with startups, private sector, and also just some super smart and creative individuals to help in the fight against COVID-19. I just wanted to mention a couple of those now. So the first one, some of you may have heard about, particularly those of you who are joining from UNDP, is the COVID-19 Detect and Protect Challenge. So with this, we've partnered with some private sector big tech companies like Google, Microsoft, Amazon, Hackster, and others to hold an open innovation challenge for hardware solutions that have been developed by startups and individuals focused on detection and prevention measures to fight COVID-19. So the challenge just finished, and we have almost 400 open source, low cost, easy to reproduce inventions. These are not just ideas from innovators across over 50 countries, and many of them coming from the developing world, which is really neat. So we're actually right now working with UNDP's field offices and local makerspaces to implement a lot of these solutions in lower and middle income countries. So we'll keep you guys posted through that. Also, shameless plug, we do have a live stream event on the 12th of August to announce the 10 grand prize winners by all of our partners for this challenge. So I'm sure we'll be signing you all up to our mailing list, and we'll be sending around more info on that. The second initiative that I just want to briefly highlight, where we've been collaborating with private sector companies, universities, and governments, is this open source digital toolkit for COVID-19. So we've been partnering with these entities who have wanted to make their tested digital tools and apps that they've been using to deal with COVID-19 locally open source, so that they could be easily replicated or built anywhere in the world. So we have over 20 tools, and we've been working with our field offices and advising them and governments on this. One just quick example is the government of Mauritius that we've worked with, also with our local UNDP office, and an entity in the US who actually built this tool called OpenEllis. And this has helped the government to improve efficiency in reporting capabilities of hospitals dealing with large volumes of COVID-19 tests and patients. So instead of building and testing their own tool from scratch, being able to implement something that was open source, that was created by another entity, helped save them a ton of time, and also $4 million of what they had actually budgeted to build and test this. And now they're working to scale this up across the country, which is really cool. So these are just a couple of interesting things that we're working on with private sector on tech solutions for COVID-19. So now, to help set the scene, I'm going to hand over to Dr. Niju Tay. He is the head of international and development at the Knowledge Transfer Network. UNDP, which works in tandem with the UK government, and since the outbreak of COVID-19 has actively implemented rapid innovation interventions in the UK and a number of African countries. So we'll be hearing more about that and their SME involvement in these efforts from Niju, who is in charge of facilitating the development and implementation of strategic research and innovation partnerships with key economies around the world. So over to you, Niju.
Thank you, Janine. Thank you for the very, really nice introduction as well. Thank you so much. Good morning and good afternoon, everyone. So I'm joining you here from Cambridge in London, near London. So it's a pleasure to be here, sharing the work of KTN in the UK and in some developing countries during these very unprecedented times. My key message to share with you today really is that collaboration for positive change is essential in the response to COVID-19 pandemic and in helping us building better our society. So I'm Niju, as Janine mentioned, and I'm Head of International at the KTN. And I'd just like to quickly, if I may, talk about the KTN very briefly, Janine, if that's okay. If you help me to get the next slide, please. Brilliant, thank you, Janine. KTN is the UK's National Innovation Network, established by our National Innovation Agency, Innovate UK. And for the last 15 years, we have been working independently at the interface between business and government to drive the UK economy, as well as its official development assistance or ODA objective, really through technology innovation. And in particular, we really focus on achieving the outcomes through domestic and global collaborations between private and government agencies. With about 200 staff across key sectors, mainly based in the UK, we work with over 60,000 organizations and businesses to facilitate more than 500 collaborations every year. And ultimately, our purpose is to create diverse connections through innovation that drive positive change around the world. And our vision is ultimately to establish a network of innovators, and by innovators, we mean technological, policy, and investment innovators that is so powerful that its idea will change the world. So to be, so we are certainly very ambitious in what we're trying to achieve in the UK and around the world. And in my next slide, I just want to go into a bit more details in terms of the work that we have been doing in the UK, and subsequently how we've taken some of the work into our African partners as well. So in the UK, as you know, UK is one of the most affected countries by COVID in the world, with over 300,000 confirmed cases and over 46 casualties, unfortunately. And the KTN has worked really tirelessly since the outbreak to support societal needs, not just in the UK, but subsequently in some of the overseas countries, as overseas partners as well. And our approach can really be summarized in these three pillars. So initially, we respond very reactively to short-term requests from the government and from private sector at speed and with impact. And in that, for example, we work very closely with our health and manufacturing materials teams, work really closely with the Formula One teams in the UK to establish a manufacturing supply chain within 36 hours of receiving the final design to help establish companies of manufacturing supply chain companies that were capable to meet the medical standards. And that was really such a active response was only possible because we had trusted and working relationship with all these companies. And we work with about 60,000 companies, as well as under the guidance of Innovate UK, our National Innovation Agency, we were able to do that together. And then secondly, in helping to build back our society, to build a more inclusive economy and society going forward, very much around focusing on recovery. We brought together growers, supply chain companies such as Siemens and the supermarkets such as Sainsbury's in the UK to unlock some of the bottlenecks in the supply chains of our food, the supply chain challenges or bottlenecks in the food supply in the UK during the lockdown and going forward in the future. We also look at how some of the mathematical rationalization models could be used to unlock the workforce, return to work after after lockdown. Interestingly as well, one of our senior members is involved as co-director on the UK's vaccines manufacturing task force. So again, we were able to do all this work very rapidly and be able to bring everyone together because we understand the roles of private companies, startup companies, as well as the roles of key problem owners such as the UK government agencies to unlock some of the challenges and to look further down the line in terms of how we could build a better society from, as a result of the COVID for future resilience. Now, on the back of what we've done in the UK and from our international work working with over 25 countries, we also built a series of intelligence working with the likes of UK, in the UK itself, with Germany, in Italy, Spain, Canada, South Korea actually, and Singapore. And we built quite a database of global intelligence on lessons learned, capabilities, and ability to support international development. And with that, we are currently through our Global Alliance program, which is a co-development, co-investment from our two departments, the Department for Business, Energy and Nurture Strategy, and our Department for International Development, or DFID. Under the leadership of UNDP UK, we're currently working with South Africa, Nigeria and Kenya in looking at how we can help to support their current responses and subsequent recovery, as well as looking at how do we facilitate knowledge transfer, working between in partnerships again between government agencies and startup companies and innovation hubs in the three countries to try to address some of the challenges. And as you know, countries like South Africa, in Africa, in particular South Africa, the situation is slightly behind the UK, slightly behind Europe, and it's expected to get worse by the end of this year before it gets better. So we really very much invested our effort into trying to work with the government and the private sector in this country to look at the recovery the recovery and the future resilience of the economy. So in summary, I just want, just to keep on to time. In summary, I just want to say that we at the KTN have worked tirelessly to help the UK and Africa partner countries in building back better. And I think I can safely say that trusted collaborative partnerships between private and public sectors have really been the key and foundation to our success so far. And more than ever, it's really important for us to really remember that. Janine, and with that, I hope I hand it back to you.
Wonderful message. Thank you. Thank you very much for that, Niju. I think that very much set the scene well to hear from our next presenters, who are four innovators in the private sector space. So we're giving them all rapid fire, 5 minutes each to present about their innovative solutions and services responding to COVID-19. After these presentations, we're going to have a panel discussion and an open Q&A. So please do type your questions in the Q&A chat in Zoom so that we can get to them during the open discussion. So I'm going to hand over to Huimin Lee, who is the Chief Marketing Officer for Timuto here in Singapore. Huimin oversees the organization's communication and outreach to help Timuto's solutions reach end consumers around the world. So I'm going to stop sharing, Huimin, so you can share your presentation. Great. Yeah.
Can everybody see my screen? Okay.
We can.
So, hi, everyone. Yes, I'm Huimin and I'm the Chief Marketing Officer of Timuto. Thank you, Janine. Like many people, before I joined the food industry, I thought that the global food trade is very well connected and, information flows easily and seamlessly from farm to fork. However, being 5 years in the industry and 2 years working for a global fresh produce marketer and distributor, I realized that that is far from the truth because the global food supply chain is actually very much complex. And because of that, it's very much digitally fragmented. And we actually face a lot of issues due to this lack of information flow. For instance, we have global food loss amounting to 1.6 billion tons a year. We have a lot of trade disputes that go on with every trade, lack of financial access to trade financing opportunities, lack of market access, and so on. And these problems are actually further exacerbated by COVID-19. So if you think back to the start of COVID-19, you can remember that the supermarkets in Singapore, they actually, faced some supply issues. A lot of things were running low on stocks, and supermarkets had to scramble to look for new suppliers. This happened worldwide, but at the same time, you also, read and learn about, farmers in the US throwing away gallons of milk, throwing away a lot of produce that they weren't able to, really change and meet with the new demands. And so this is really very much a global problem. So here at Dimuto, we think that digitalization is key to solving these challenges. So over here, we have an example of a fresh produce trade that we've helped to digitize. This is Iwan. He is a 4th generation farmer in Australia, and he grows fresh produce like fresh plums. So once these plums are actually harvested, every carton and punnet is tagged with a Dimuto QR code, and then we track and trace them on our Dimuto platform as they move along the supply chain. And when they reach the consumer simply has to scan the QR code in order to trace back the traceability information. So how can such, digitalization actually help to solve these challenges? An example is our solution being able to help identify the source of food waste that happen along the supply chain. This is an example of fresh Fuji apples from China being received in Indonesia, and the buyer in Indonesia actually said that, hey, this supplier actually gave me poor quality apples. But using our solution, we actually discovered that the source of the food waste was actually caused by the buyer's improper storage practices instead of further upstream in China. Another example is that digitization can actually help us to empower suppliers with trade financing opportunities as well. This is an example of how we've helped to finance up to US $2 million of trade for Thailand's largest durian exporter. And so how we digitize the trade is by tagging every single carton and every single fruit with Dimuto QR codes, and then we use our proprietary Decky devices in order to digitize these assets. So this is a real packing house in Mexico. You can see the video on the left is how we actually label every single avocado. And then over here on the right is a typical conveyor belt of a packing line. And this is a packing house in Mexico. And as you can see, our Decky devices are able to capture a photo of every single carton as they move along the packing line. And all this product information is then tracked and traced on our Dimuto platform alongside trade documentations like shipping information such as bill of lading, sales and invoice information, product certificates, health certificates, and so on a single verified platform. And we also close the supply chain loop by allowing buyers to really provide us feedback on the spot using our mobile application to be able to capture the quality of the fruits upon arrival as well. And for end consumers, we are definitely able to engage them. When they scan the QR code, they're able to access provenance information as well as leave feedback directly to the farmers themselves. And currently, we are actually in 8 countries and more, and we've helped to digitize the top fresh produce categories such as citrus in US, avocados in Mexico, apples in China, and durians in Malaysia and Thailand as well. And yeah, we have been on this journey, crazy 1-year journey to demystify the global agri-food trade, and we are definitely very excited for what's to come. Thank you.
Great, thank you so much, Weemin. That's super interesting what you all are doing, and I'm glad that the Global Centre is already working together with you guys on some of that in our ag portfolio. So let's move on. I'm just going to share my screen again. Here we go. So our next presenter is Chisnall, and he is the Sorry, he's the CEO of DriverNet in the UK. Ant actually founded DriverNet in 2017 and has extensive experience across operational and senior roles in transport, warehousing, site contract management. So he's been able to do some really, really cool things with all of that background. So Ant, over to you. And if you can put your video on as well, that would be great.
My video should be on anyway, so I'll just I'll carry on, Janine. Hi everybody,
Okay.
Ant Chisnall here, founder at DriverNet. What I'd like to do is take you through what DriverNet did before COVID, and then some of the challenges and connections that we had as COVID broke out, and then how we modified our product, and then where we want to take it to modify it further. We've already started working on that. We've connected with the KTN actually in the UK to help us connect with local authorities to use our mobility platform to help build a more inclusive recovery. So next slide, please, Janine. So this essentially is what we do at DriverNet. We take people from operators from a paper-based printout analog world into a smart digital platform to connect all their people and partners in the field. Next slide, please, Janine. So first and foremost, we do the vehicle check, inspection checks. Normally that's a piece of paper check. We do that, securely host it online. Next slide, please, Janine. Then we offer your basic telematics, route management and messaging. So it's kind of Yammer or WhatsApp integrated into traditional route management services. Next slide, please, Janine. We profile the locations of passengers, of patients, of citizens, and of sites as well, so drivers can see that before they arrive at the site. Next slide, please, Janine. And then we obviously do standard telematics and tracking as well. And this is a great add-on for people who are kind of dispatching people and connected into the field with paper-based. They've now got a real-time picture of where all the teams are out in the field. Next slide, please, Janine. And then finally, we also do incident reporting and wellbeing checks. So rather than just deliver a product or pick somebody up, we can feed back how they are in person, and also basic telematics and tracking. So that's the last slide there. Next slide, please, Janine. So this is who we worked with before COVID broke out. All local authorities. It was health and social care, transport, waste and recycling, security couriers, and facilities and management. So this was an enterprise product that we had. And then obviously when COVID broke out, our local authority reached out to us and we started working with the next slide, please, Jenny. And then all of a sudden we had fleet operators who were delivering foods and products and serving people for the first time. So we worked with social enterprises, multimodal e-bikes, cyclists, van deliveries. We also work with charities, so dispatching volunteers into the field, not just with food, but to do welfare checks with people who are shielding. We work with the NHS blood bikers, so these guys were delivering urgent bloods between hospital A&E departments. And we also work with local authority minibuses and transport as well, rough sleepers delivering food to people in hospitals. So all of a sudden we had to service these new supply chains and new transport operators, many of them working with volunteers who'd never worked in a supply chain before. Next slide, please, Janine. And these were some of the challenges that we had straight away. So obviously, we have a cost for our enterprise customers. So what we actually did there, we initially gave them the product for free so they could just start using it. And we also launched a Go version of DriverNet. So it's a light version just to get people up and running using the core features of it. We then had customers saying they had no mobile signal or they couldn't afford to buy the smartphones like enterprise users. So we had an SMS gateway, put an offline mode in, and we also used voice messaging so we could alert people via their landline that a delivery was on its way. And then the huge challenge that we had was a lack of experience, as we already talked about. Many people using volunteers for the first time. So what we got it down to was giving people the platform for free, getting them set up on the same day. And then crucially, we also added in route optimization, which reduced a hell of a lot of inefficiencies for these teams. So that's how we helped COVID challenges. And next slide, please, Janine. What we also found as well is that all of these vehicles that we were using, so this is where we want to go next. We want to convert all these customers into a SaaS platform. We also believe that we've got a system here that can operate as a primary transport management system in emerging nations. It's practical, it's universally accessible, it's low cost, it's an Android device. And also as well, critically, and this is where we've worked with the KTN, we're going to now evolve the model into an Uber for community. So when these vehicles have traditionally been parked up after doing school runs or doing adult social care, normally they're parked up for 5 hours in the day and many hours before and after that. We're now going to use them to connect people to doing more inclusive recovery and get people out of their house to really cut through kind of health and wealth inequalities and have more connected communities where people can get out of the house. So that's DriverNet all wrapped up in 5 minutes exactly.
Great, thank you so much for that. I think it's exciting to see how you were able to really kind of shift the work and the focus of the company as well to respond to the current demands and situations. So looking forward to hearing more during the discussion. So next, here's Ant's contact if you want to contact him, but we'll be sending all of this around later. So next up, we have Dr. Min Han Tan, who's the founding CEO and medical director at Sense Diagnostics here in Singapore. Han is the founder, as I just said, and his research background centers on innovative cancer diagnostic technology and data analytics, and he's contributed to over 100 publications and also has received international research awards. So, Han, over to you.
Thank you so much for the introduction, Janine, and I'm very happy to share our story. And next slide, please. As very quick background, I'm a medical oncologist by training, and I founded Lucence in 2016 to commercialize the diagnostics I had invented while at the Agency of Science, Technology and Research, A*STAR, in Singapore. The work specialized in the ultra-sensitive, non-invasive diagnostics for cancer and cancer-causing viruses. And today we have 2 accredited service labs in Singapore as well as the United States. We have a very strong focus on innovation with 15 PhD staff among our 75 staff spread across 4 offices. Next slide. And things were going along fairly smoothly in terms of the company until the onslaught of COVID-19, which, as we all know, has devastated the globe. And as a company where medical diagnostics was our specialty, I think never in the history of humanity has so much attention been focused on the challenges of diagnostics. Today, across the world, we are seeing the difficulties in restoring the economy, in looking at the difficulties of population testing, of how to restore air travel. And actually, many of the bottlenecks in testing begin at the challenge of sampling. And as you can see from this picture, there are many problems here. Firstly, trained healthcare personnel are required. There is risk to the healthcare personnel, and that's why the healthcare worker is wearing personal protective equipment. That PPE is expensive. And finally, as you can see, it is uncomfortable for the person being swabbed. And this is a major bottleneck. Today, across the world, it is estimated that millions of tests will be needed per day if we are to achieve control. Next slide. And as a specialist company in diagnostics, we looked at the problem and we decided that saliva testing would be a solution to that first sampling bottleneck. And we developed a technology called Safer Sample. And Safer Sample is dedicated to the cause of obtaining sensitive detection of COVID-19 virus in saliva, which you can imagine would be a non-invasive, painless approach to the problem. We developed the technology to that would also be safer because that would inactivate the virus, and it would be able to be used in countries where transport might be harder from the site to the lab. And this, in pending data, it's been proven to be 36% more sensitive than the gold standard. Next. And to complete this, I think we want to achieve global adoption, and we are working with global organizations, including the WHO and multiple governments, to achieve greater adoption for non-invasive testing, to reduce the key bottleneck to sampling. So thank you very much, and I'm glad to share here.
Wonderful. Thank you so much, Han. It's really, really impressive, everything that you've been working on, and a lot that I don't even understand. So thank you so much for breaking that down for everyone. Looking forward to hearing more about it. So our next presenter is Mark Nicholson. He is the CEO and founder of Vivacity in the UK. Fun fact, Mark actually co-founded Vivacity Labs with two partners who he met while designing, manufacturing, and racing a road-legal solar-powered car. So his current role allows him to combine his experience and passion for bringing artificial intelligence to the transport systems we all use every day. So Mark, over to you.
Fantastic, thanks very much, Janine. So brief introduction to Vivacity before we start. Our goal as a company has been to redefine the way that cities manage their transport networks. So that's looking at everything from understanding behavior at a junction to strategic planning, from alerts that the vehicles are broken down to perfecting traffic lights with reinforcement learning. So we're introducing AI across the spectrum into the way that cities manage transport. Next slide, please. So to talk specifically about our capabilities and how they relate to COVID, I'm going to focus primarily on our ability to gather data. So what you can see here is some of our AI algorithms used actually on a road in London to identify and classify different road users. It's a very similar set of technology to that's used in autonomous vehicles for them to understand what's happening on the roads, but we're using it on the infrastructure to give the people who manage those road networks a deeper insight into what's happening. So we can use that to gather data, looking at classifying different vehicles, extracting insights on speeds, journey times, behaviors, how people interacting at intersections, really getting under the skin of that transport network. Next slide, please. So just to give an example of that in action, these are then the trajectories of all the vehicles that we've seen within that space, color-coded by the types of vehicles. So in the bright pink there, you can see the cyclists, and you can see most of them taking fairly standard routes across the road. But actually, if you look carefully, there are a couple that cut left from the bulk in the middle there and cut across the pavement. And so that was a very interesting insight for our clients in terms of how people are actually using this junction. So how do we as a company use this kind of capability to tackle COVID? So if we can move on to the next slide. What we're doing is using these trajectories of understanding where everyone is and how they're moving around over time to look at social distancing. So we've taken the vast trajectory data sets that we've got, we've analysed those to look at where people have been different distances apart, and we've used that to understand what is happening across the country in terms of social distancing. So you can see here, we've drawn red lines between the ones that are less than 2 meters apart, which is the UK government's sort of recommended limits. We've drawn yellow lines where they're sort of up to 3 meters, and then green lines if they're further away. So this kind of starts to demonstrate some of the capability of using this data to actually understand what's happening within the UK. Now, as a company, we have sensors in about 30 towns and cities across the UK. So we've got a national network, and within a few days of lockdown, we were starting to use this data to generate an understanding of what people were actually doing with lockdown. So if we can move on to the next slide. So what I've got here is some of the insights from that so far, looking at how many people or how many social interactions of less than 2 meters have there been over time across the country. We've broken this down into different types. So looking at city centres, for example, the blue line here, you can see that before the lockdown, which happened in mid-March in the UK, we kind of indexed everything to pre-lockdown numbers, so it's roughly 100%. And then suddenly, shortly after lockdown, it dropped to about 10% of the previous number of social interactions. Huge drop off very, very rapidly as lockdown came into effect. And you can see it's been gradually climbing back up since then. So we've been using this data and providing this data to central government on a very regular basis, twice a week, to help them understand how are people actually responding as we come out of lockdown, and how is that influencing the sort of breakouts of COVID across the UK. Move on to next slide. And it's not just social distancing that we're looking at, it's actually the broader behaviours, because one of the things that is very interesting to government is how can they use, or how can they help the recovery from COVID and use that to promote different kinds of travel. In this case, it's all about how can we use it to promote cycling as we all experience huge shifts in traffic demand. So what we've got here is a series of different cycling demands over the time of day based on the month. So the different lines of different months. So in the turquoise, we've got pre-lockdown numbers where you can see a huge spike in the early morning and spikes in the sort of late afternoon as well, corresponding to rush hour. Whereas post-lockdown, all the orange lines, you can see that the morning spike has been dramatically suppressed and the evening one's been spread out. So there's been huge changes in the way that people behave as a result of lockdown. So those are a couple of examples of the way that we've been helping central government with data and insights about COVID. It's much more that I could talk about, but I think I've come to the end of my 5-minute slot. So thanks very much and looking forward to speaking more later.
Wonderful, thank you so much. Mark, this is really interesting, especially seeing how you've been using behavioral insights as part of it, which I know that the UK is very big on, so would love to hear more about that. And it's something that UNDP has been working on a lot as well. So thank you to you and to everyone for sharing about these exciting initiatives. We're going to dive a bit deeper now into a panel discussion. So I will stop sharing my screen. So during this panel discussion, we're going to be hearing about more insights in your experience, lessons learned, and the relevance for COVID-19 and developing countries as well. So this is going to be moderated by Annabelle Cheong, who's the Deputy Director of Venture Investing with our partners, SGInnovate. So during this time, we'll also be taking questions from the audience. I know that we have a couple. One has been answered online already. So everybody, please start putting your questions into the Q&A chat, and Annabelle will take those throughout. So thank you, everyone. I'll mute myself for now.
Thanks, Janine, for the intro. And once again, a very good morning or afternoon to everyone. I hope you found the presentations informative and inspiring. We now have the pleasure to engage in conversation with our guests on the topic, the role of private sector innovation in COVID-19 response and recovery. I'll ask a few opening questions and leave lots of time for all of you to participate. As Janine mentioned before, to ask a question, simply type it using the Q&A function on Zoom and we'll get to them. So to kick us off, panelists, how did you come up with a COVID-19 product so quickly? Or if you've adapted your product or technology so quickly, what do you think was key to executing and getting it up?
I think for us, it was really important to have a couple of elements. One was government engagement from very early on. So UK government put out a call for data within a few days of lockdown, sort of saying that they really needed to understand what was happening on the networks, and that helped us understand a bit more of the need. So I think having people be very open during this time has been very helpful. And I think there's been a big sort of community push to understand what is needed. So I think that's been a sort of major driver for us. I think the actual development of the capability was not very hard on top of what we already had. That was done in a few days. It was really about understanding what was needed rather than the time taken to deliver it.
Thanks, Mark. And Minhan, I see you're ready to speak.
I am actually, and I wish I could have said I shared the same experience that we suddenly pivoted and solved the problem. But actually, for us, the story began nearly 4 years ago, and we had been tinkering around in the lab and to develop solutions for another pandemic, and that was the Zika virus. And at that time, we had a chemistry, a chemistry graduate working on the topic of developing non-invasive technology. And I think we had developed that non-invasive way to detect Zika in virus. And it was sort of put on the back burner because as pandemics are wont to happen, people tend not to worry so much after a pandemic is over. And I think when the COVID-19 pandemic started, we realized we had technology to help solve non-invasive saliva diagnostics, and so we rapidly developed that for widespread use.
And was it the same as Mark as well, where the development process was in days, or was it a longer development cycle there to adapt the technology for Zika?
I think I see it this way, that this is actually a long-term investment of the government in terms of its manpower, its the entire focus on science and investment. And without that, we wouldn't have been able to assemble the people, right? The laboratories, the research topics. And I think in perspective, I have to put it this way. 4 years ago, it was a chemistry graduate working in a cancer lab on an infectious disease topic in an engineering institute. And this type of multidisciplinary work doesn't appear out of nowhere. And so I think this would represent a very long-term investment by the government, the Singapore government, in innovation.
Thanks, Min Han. Hui Min or Ant, would you also have some stories to share?
Sure. I think our story is a little bit similar with Min Han, in the sense that our solution was not developed solely for COVID-19, mainly because the agri-food industry is somewhat of a traditional one, and the problems that plague it have long existed before COVID-19. The pandemic simply spurred a lot of companies to start on this transformation, digitalization journey, because COVID-19 just made all the problems even more apparent. And so I think during the pandemic, there was uptake of our solutions as well. And that's why we actually have worked closely with local retailers to bring in new suppliers, avocados and blueberries from Peru, and to really help, to meet the demand shortage as well during the COVID-19.
Thank you. Thanks, Hui Min.
I think as well, if you don't mind driving it, we were quite fortunate that our customers were already local authorities. So when the UK went into lockdown on the Friday, our local authority called a meeting on the Monday morning. We got invited to it. And in that meeting, I think it was representative of probably pretty much every local authority across the UK. You had charities, you had social enterprises, you had the councils themselves. Information was trickling in from national government. And what we saw was that there was going to be a very they knew that they needed to get food out to people who had been put under the shielding. And we saw straight away it was going to be incredibly ragtag, lots of paper being handed about, lots of phone call communication. So we were given the opportunity to work with these partners. And in terms of development, we already had an enterprise system. It was just a case of understanding they weren't going to be able to pay for a product initially, so that wasn't a problem. We wanted to do our part as good citizens. And then latterly, maybe 40% of people in the UK have an iPhone, so we only had Android. So we developed that, and we've done everything in sprints. So we did the first one in a 4-week sprint, and we're still developing for them now. And we've just put our original pipeline on the background, but that's how we went about it.
Thank you, Ant, for sharing. And that's certainly a very enviable position right there, to have the local authorities knock on your door. I'm not so sure whether the rest of them had the same experience. So just shifting gears, also talking more about work with local authorities or the local government. Would the panelists be able to share with us your experience working with the public sector on the initiatives, and whether there was a specific acceleration of the development or the adoption of some of your products because of the work or the linkages with the public authorities?
So from our side, everything that we do, or almost everything we do, is with local authorities anyway, and they are our primary client set. So we've definitely seen an acceleration of some of those discussions. We've seen that lots of local authorities want to move very quickly given the pandemic. We've engaged probably much more with central authorities than we had before. So Department for Transport, for example, and much like Ant on that side of things, we offered a free product there for a while to try to help out with what was happening and to give them data and insights. And then actually to touch on one of the questions in the Q&A in terms of turning that into revenue, that the revenue came later. It was about helping to make sure the response was as quick as we could be in the first instance, and then worrying about where the money would come from after that. So yeah, we haven't found, going back to your question, Annabelle, we haven't found local authorities particularly challenging. If anything, they've sped up during this time.
And I certainly want to echo Mark's comments about the public sector accelerating the entire process. I think we certainly work with many governments, and at the same time, I certainly want to acknowledge the Diagnostics Development Hub in Singapore for working together to generate more evidence, such as the safety data and as well as performance data that everyone needs. And so I think the role of public-private collaborations to create solutions, that's certainly something that the pandemic has highlighted.
Thank you, Min Han.
I think for us, well, actually, we have been working closely with local government agencies as well as government embassies from around the world. And I think why they are so forthcoming and eager to help us and introduce us to their markets as well is because, the lack of visibility of the supply chain is such a prevalent problem that at the national level, this impact is felt as well. So I do think that as with the COVID-19 pandemic, there has been a lot of focus on the lack of digitalization and visibility of the supply chain. So I do think that has really spurred our collaboration in that sense.
Thank you.
And,
so I will, sorry, go on.
Sorry, I was just going to say, in terms of driving, I know I've already touched on it. We've helped solve a problem right now that's, arguably we've contributed to helping people out, but what we also looked at as well in terms of public sector engagement, a lot of our technology is based on satellite technology. So we've worked with the European Space Agency, who have a call out at present. We've passed phase 1 successfully, and that's about using these vehicles to really tackle the problems that have underpinned many of the health inequalities in COVID. Bottom line is transport is a key factor in people suffering from poor health or mental illness. So we've worked now with the European Space Agency to leverage their funding to propose a model where, instead of these vehicles being parked up all around the world, and it's a global problem, passenger vehicles are highly underutilized. We want to kind of give them the Uber type technology to connect them to get people out of their homes as well. So we've been fortunate enough as well thus far to have the public sector backing from the European Space Agency and the UK Department for Transport as well. And hopefully we'll see those funds drop in the next month or two.
And to anyone in the public sector in the audience, I think the acceleration that we've seen recently has been fantastic for innovation in the space. And I'd really encourage the mindset that's prevailed over the past few months to continue, because I think that's the way to get innovation into the public sector, which has traditionally lagged behind the private sector. Whereas I think that what we've seen recently is public sector really pushing ahead and driving that, which has been fantastic. So I'd really love to see the public sector keep that lead and keep that mindset as we exit the pandemic as well.
Thank you, panelists. I will switch things up a bit and turn your attention to the Q&A chat box. So Mark has alluded to this question earlier. So it's a question by Grace Garanson. And I think it's an important question which the panelists can share their thoughts on or share their experiences. Her question is, how difficult or easy has it been to commercialize your COVID-19 solutions and turn it into revenue? Anyone wants to start?
I think for us, for Dimuto, I think pretty easy for us because we already started way back in 2019 and we are already in 8 countries. We've worked with many different players in the agri-food industry. So the key thing is to really sort of demonstrate the value with pilot trials, and after that, you know, the commercialization and the uptake would be pretty fast, I would suspect, because, you know, we really save them in terms of the trade dispute costs and the lack of visibility problems as well. So once we solve that for them, I think a lot of the companies that we work with are very, you know, eager to uptake our solutions.
Thanks, Wei Min.
I'm also happy to comment on our side, and I think certainly I see 2 issues here. One is adoption and the other is supply chain, right? Because without a working supply chain, you can't make and manufacture. So on our part, for medical devices, this is a heavily regulated environment, and I'm glad that, you know, our technology is being adopted, and we are helping to fulfill needs across several countries out there for non-invasive COVID diagnostics. I certainly want to say that the supply chain issues were very much highlighted during this pandemic, and understanding how to source things, how to manage lead times, inventories. These were also key part of scaling up the manufacturing process that we had to learn.
Thank you, Min Han. And or Mark, any comments there for the question?
So I touched on it earlier, but I think from our side, I think the sort of commercialization has come in 2 phases. I think to start with, it was the give it out for free to make sure that people understand the solution, and particularly to just make sure that government can react as appropriate. And then we've seen that that sort of favour, if you like, come back later. And so I think it's been about flexibility on commercial models during this very challenging time, where some bits of government want to move very quickly, other bits of government, either procurement teams, do not. And so we've been providing value up front and then worrying about the legals and procurement and money side of it much later. And I think that has worked. It's obviously high risk, but it's been what's been required in this time, and it has delivered dividends in the end.
Glad that has worked out. Thank you, Mark. So we'll move on to the next question. So the topic of personal data protection and privacy has also come to the forefront for COVID-19 solutions. So how have you panelists taken into account privacy protection and also personal data protection for your solutions? And what would you have any advice to also offer to the audience?
I'll take that one first, very quickly. So we already had all our measures in place previous to it, and obviously we're working with startups in many occasions who weren't familiar. So for us, it was a case of, you know, we have all our international accreditations for privacy policies and data security, and we were already working with councils, local authorities. We process some of probably the most highly sensitive data that you can on individuals, patients, people with special needs, the elderly and the vulnerable. So all our measures were in place, and we just came up with truncated versions of our SaaS contracts just to cover everybody off, and quickly got our customers to sign them off. And then at that stage, then they were happy for us to process the data for them.
Yeah, I think from our side, I suppose my view is that in this day and age, everyone and every company needs to be conscious of privacy, and it should be built into the way that everyone works. I think we've now advanced enough as a society that should be, you know, front and top of mind. So for us, the core solution that we do is video analytics. Yes, we're putting out lots of cameras out there, but all of those cameras are processing everything on board the device, discarding the video, only keeping the anonymized data, sending that back. So privacy was baked into it from the start, and I think all companies should be thinking about that. I don't think there is really space anymore for people to ignore it fundamentally.
Absolutely, and I think for us, we are a medical company. We deal with healthcare data. I think maintaining that privacy is core to our DNA.
But so Thank you, Minhan, Mark, and I think what I'm hearing also it's by design, it's inbuilt, and it's already part of your DNA and what you've been doing. But then, how then do you actually determine what's enough, or what's appropriate, or to what level or degree do you or extent do you do it to?
Maybe I'll just say that I think right now on a worldwide basis, of course, there are accreditations, there are certain norms in terms of how laboratories handle medical data and healthcare data for the benefit of the patient and physician. So I think we certainly subscribe to that, and I think that privacy is key. At this moment, in terms of supplying COVID-19 diagnostics, I think that's something which allows the decentralized diagnostics. I think we do supply the products that will allow medical labs all around the world to achieve painless testing. And I think that's something which allows also for the different labs to maintain the privacy of the data within their own countries and their own labs.
Thank you.
I think I would lean on the experiences of the car sector looking at safety when thinking about what is the right level to go to. I think the regulations in car safety always lagged behind the reality. The car manufacturers were competing with each other, not with the regulator, to make sure that everything was safe. And I think the same thing should happen here. I think private sector should be pushing the boundaries of what is right from a privacy perspective, because we can react to what people want much more rapidly than a regulator can. So sure, GDPR and its equivalent regulations around the world should be the baseline, but I think we as a sort of private sector have a responsibility to push beyond that to make sure that everything is as private as we can possibly make it, in order to make sure that we are selling the product that that sort of has the maximum appeal.
Thanks very much, Mark. I think that's really an important point. It's not about the regulations being the standard, but rather being the baseline in private sector, actually pushing the boundaries just for privacy and personal data protection. So moving on, we have another question from the audience by Stefan Angles. So his question is, do the panelists think that the experience of collaboration between private and public sector will last post-COVID and lead to closer partnerships and more understanding for each other's sector?
I'm happy to go first if other people are still thinking. So I think it will certainly help to some degree. I think some members of the public sector have seen some of the benefits of the faster innovation from the private sector. I think there will be a level of reversion afterwards. I think the procurement side of things that I mentioned earlier isn't going to change during the pandemic and is going to reassert its authority afterwards, I suspect. So I think there'll be some changes, but I suspect that there'll be a reversion largely to norms unless there is a really serious top-down effort to change that and to rip apart some of the procurement ecosystem that I think does slow down innovation across the public sector.
Thanks, Mark.
I guess from my perspective, I think COVID-19 has highlighted many vulnerabilities around the world in terms of supply chain. I think it's highlighted many problems that where different countries will have different sort of capabilities to manage. I do expect that following the end of the pandemic, which none of us know when that will happen, I think there will be countries that will, with the capabilities to plan and to adapt for the next pandemic. I agree that with Mark that this type of planning may not be uniform.
Yeah, maybe. Sorry, Annabelle, can I jump in very quickly?
Yeah, sure, of course, Niju.
A slightly, added perspective to the discussion as well. I could talk about it from our experience in terms of doing this for the last 15 years in terms of private-public partnership. And with respect to COVID, our effort is focused beyond the COVID, beyond just recovery, is about future resilience as well. And in the UK, there's a lot of discussions ongoing, but in particular, what's really interesting is in experience working, for example, in South Africa, for example, and they really would like us to help put together a public procurement process that would encourage more procurement of innovation into the public sector. Right. So these are the key things, some of the key initiatives, some of the initiative and discussion we are having with locally in Africa, and also looking at how do we target informal and informal and informal sectors as well to be more inclusive and promoting township development. So when it comes to this, the private-public partnerships are very are key, and private, I mean, also working with local governments as well. So we're looking at recovery, we're looking at resilience, and we're looking at how some of these initiatives could be more could be sustainable beyond COVID as well. So I think my fingers are very crossed that some of these will continue after this.
Great.
Yeah, I think similar.
Yeah.
Go ahead.
Yeah, I think similar to what Niju said, even in Singapore, the government has already come up with, the 30 by 30 policy to start growing our own food and to source from even more countries. So I do think that the resilience of our supply chain is at the top of mind of government agencies. And I'm quite optimistic about the continuation of our close collaboration.
And I think it's up to all of us around in this room or on this webinar as well to really try to carry that message after this session.
Thank you, panelists and Niju as well. I think as Niju also alluded to, I think we want to, now wearing our UNDP hat, we want to move on also to speak a bit about the developing countries context. So how relevant do you think all of your solutions are for developing countries? And also if there would be any, given that you are private sector companies operating in developed countries, do you have any advice also for private sector companies operating in developing countries? So maybe you take, maybe the panelists can take the first question first of how relevant do you think your solutions are to developing countries?
I think for Dimuto, as mentioned, we are already in 8 countries and more, and we are already in these developing countries. We've helped to digitize flowers in Colombia, avocados in Peru, Mexico, durians in Thailand, apples in remote areas of China. So I do think that this digitization and supply chain transparency can help this players in these economies to keep their supply chain costs low and to really remain competitive globally as well. So I do think that our solution is definitely something that's very relevant to these economies.
So I will also say that we are working with the WHO. We are working with several countries to make non-invasive diagnostics available. It's a real challenge because looking forward, one of the major questions is how borders can be opened up, the type of economic activity that can be restored, and the stability of how the economies will and how things will actually open up, especially in countries with less resources to manage testing and human movement. I don't think I have all the answers in terms of how that situation is going to unfold, but I do think it's become very important to get the connections and people flowing.
I think from our perspective, we purposefully designed DriveNet as an Android solution initially. There's now billions of Android devices in play all around the world, and in your emerging markets, what we do is offer people or operators a transport management system that doesn't need the cost of installation of black boxes. It doesn't need training. It doesn't need any kind of capex. You can buy really low cost Android devices, or alternatively, we can use the Android devices or the iOS devices of the actual fleet operators, the drivers and the employees themselves. And you set up kind of what is essentially a pop-up transport management system using Android and cloud-based services. So yeah, I think we've always wanted to kind of go into the emerging markets. Unfortunately, we were hoping to have a really good year in terms of in the UK, of sales this year. It's been probably put back by about 6 months, but I think the opportunities that will come out of COVID is that we can now get into this market sooner and hopefully use this platform and all the partners and attendees today to help to prove that.
I think from our side, just to pick up on one of Ant's points, the cost of hardware is a key sort of component of this, and it does influence the cost of the overall solution. So far, most of what we've deployed has a hardware element, and so that may mean that it's not cost effective for emerging markets. I think we also need, I think the use cases would often be very different. In the UK, for example, our clients are looking at detailed optimization of junctions and trying to look at cyclists undertaking lorries, for example, but road user behavior is very different in different countries. And so I think there'd be a lot of work required to make sure, A, that the use case is there, and B, that the economics stack up. So it's certainly something we want to explore in future, but there are major barriers from our perspective to deployment.
Thank you, panelists. We have another question coming in from the audience, from Tina Turinen. Her question is, do you work with networks of companies collectively to help coordinate with the public sector and other actors, or is it mainly bilateral collaboration?
Maybe I could jump into for that one, Annabelle, if that works. Sure. Because
go ahead,
as a organization working across all the stakeholders in the ecosystem, we do work with trade bodies as well. And in particular, for example, when we were working in the UK on the PPE activities, we work with the CBI, the Federation of Business, UK businesses as well. And also when we work with the farming community, we, in the UK, trying to unlock the logistic challenges for the food supply chain during the lockdown, we work with the National Farmers Union. So we tend to work across multipliers, key multipliers in our respective sectors, because they're very important for us. And also some of these multipliers are very important to us, essentially not just for reach to the suitable organization, but they're impartial. They provide that impartiality to the effort, the joint effort that we put together. And it's very important in this challenging time to have that relationship with trusted relationship and working with partners that are impartial. So yeah, so that's what I would say.
Thanks, Niju. How about the panelists? What were your experiences?
I think from our side, it depends a lot on the scale of what you're trying to do. I think we do a lot of bilateral work with the local governments, particularly where it's smaller scale. As it starts to get larger and larger, and you're talking to national people running the motorway networks, the highways, for example, then you start to need all those partnerships to be effective, to be able to do anything. So I think it's a question of scale for me, and small scale is bilateral, large scale is collaborative.
I think for us, we actually work very closely with trade associations that have close relationships with the governments as well. So for example, we are closely working with Produce Marketing Association, a very big group of over 2,000 members in the US, a group of growers and suppliers, and they are very closely working with the FDA as well in order to, see what are the collaboration opportunities and how can we, provide solutions to their members, as well as to work to meet standards of the government over there as well.
Thanks, Hui-Min. So maybe we can move back to the question on developing countries. So what panelists would be your advice to private sector companies that think in terms of the role of private sector innovation, how you've worked with governments, or what would you say to some of them who might be actually in the audience today?
I think you need...
Oops, sorry, go ahead.
Sorry, Hui-Min, you go. It's okay, ladies first.
Okay, so like for me, I think that it is important to create a solution that is for us, we are created by trade for trade. So we really focus on how can we really solve the industry problems and come at the solutions from the industry perspective. So that's why, the previous panelists all mentioned about the hardware issue. So we develop a variety of hardware solutions that can actually work for the developing nations as well. So it is important definitely to keep in mind the operational needs of the different markets. And for us, a solution definitely needs to really, provide value for the entire supply chain, and so that, supply chain transparency and visibility can really benefit everyone and not just a select part of the supply chain.
I think we've, and probably speak on behalf of all the panelists here today, we've had to have a long-term strategy in place at DriveNet, especially when you're dealing with local authorities or, national government. People like to buy solutions off trusted people who they've known for quite a long time. There's probably been a lot of exceptions in COVID where you've had startups pop up and, have huge success. But I think, it's not something that you can do in 6 months. You have to have a product that has to be trusted. It can get used by one set of customers. They'll then refer you on to others. So it's important to be patient, I think. And, I'm quite an elderly startup founder, and that patience is key. Whereas you perhaps don't see in some of the younger pups that are coming up. They need everything, tomorrow or next month. But we know that we have to be patient, and we've changed our strategy entirely from what, as I said, what we're expecting to see this year. But we're building partnerships all the way. We're going to come out of COVID with probably about 10, maybe a dozen or so new local authority customers that we can build our next evolution of the product with. So patience is a virtue.
Yeah, I definitely echo that. Patience is required to deal with the public sector. And I think one addition to that is to think carefully about your starting point when trying to work with the public sector. I think if we'd started working with the biggest fish in the sea, the Department for Transport and Transport for London's, we wouldn't be here today. We started to engage with them very early. We didn't expect to make any money from them for a number of years, and indeed that didn't happen. You have to start off with the smaller authorities who can move a little bit quicker, and sure, they have smaller needs. You're not going to sell a £1 million project to start with, but start small, build up, build case studies, build the sort of contacts, build the references within the industry, and then scale up from there. I think that's the only way to get into working with the public sector.
And we've also used the KTN as well. So we've been familiar with the guys at the KTN for 3.5 years. So whenever any kind of new initiatives or funding and competitions come out, we'll kind of reach out to them, and they have the intelligence already because they're speaking to so many local authorities, which ones are interested in it, which ones aren't. So that does help accelerate, your go-to-market strategy. And at the end of the day, let's face it, that is what the guys are paid to do. So it's not like, this is a one-off, that they're there for every startup, but it's up to you as the founder to leverage that intelligence.
Yeah, no, Anthony, thank you for that. Just to add to that as well, because one of the strengths of the KTN is because of our cross-sectoral capability. When you come to us with a specific challenge, we have a very broad view in terms of what's happening in the sectors as well, and sometimes that's really useful. Just to add to the question here, is that I would say for some companies trying to move into sort of developing countries or new markets or in the developing countries, bear in mind the concept of co-creating local solutions that will meet local needs. So sometimes we forget you need to really come from that perspective and think about the affordability of your services and products there, because quite often we have to think about the frugal innovation, the bottom of the pyramid in society, and how do you try to introduce your products to be more inclusive across the different income levels in the developing countries. And that's really important. So think about co-creation actually. What works in the advanced economies quite often may not work in developing countries, and you just have to go in with that mindset. And also the other thing is expect things to go wrong.
Definitely. Thanks Niju for your comments as well. So we're out of time, but I would just ask a last question, a quick last question for the panelists to share with us maybe your future plans in relation to the COVID-19 efforts. Are you going to develop another new product for COVID-19, or is a further expansion of your current product? What can we look on in the horizon for your COVID-19 efforts?
I think for us, our focus will probably be less around the very direct COVID-19 itself and more around the recovery side of what happens next, what is government thinking about now to try to bring the economy back into line. So for us, that is about thinking about the drive towards active travel, so cycling and walking, and how do we help to support local authorities ever better with that kind of capability. So I think the world is evolving very rapidly at the moment, and our product set needs to evolve with it. So we're sort of trying to prepare for that next stage, really.
I
So
echo
I think
that
for us,
completely.
oh, sorry, please go ahead.
Sorry to cut in again. Yeah, for us, I think it's really also more about the recovery of the global food supply chain, and digitalization is inevitable. There are really a lot of technologically changes around happening right now, and I think we will just really want to take advantage of the momentum provided by COVID-19 to really start to expand our reach and create a stronger network of digitalized food trade around the world.
I think for ourselves, we are in the business of medical diagnostics and scaling that up to help restore vital economic sectors. For us, it's a simple question, which is how can we support capacities of millions of tests per day?
And likewise for us, we're all about the recovery for communities. We're a community-based solution, and we want to connect every vehicle to all the people who live in what is termed as transport poverty. All these vehicles that sit empty all around the world every day, we want to connect them to large groups of people to go to events and activities at the same time. That's going to build a more inclusive recovery, improves people's health, well-being. I've kind of already touched on it, but luckily for us, everybody's familiar with Uber and that Uber model. A lot of people have it. And when you're speaking to local authorities, we say, well, look, why shouldn't your fleets operate similar technologies? Why should it be limited to the private sector? Actually, if we invest into this technology, we're going to get an ROI, not just on improving citizens' lives, but on reducing healthcare costs as well in the NHS or your equivalents all around the world.
Thank you. Thank you so much, panelists, for your time, energy, and insights. The panel is over, but like all the panelists said, we also have to look towards the recovery phase. How then can we do our part to come up with COVID-19 solutions for recovery? So thank you very much for joining us in conversation and for all the questions. And I'll hand the time back over to Janine.
Thank you so much, Annabelle and everyone. It was super insightful to hear about your journeys and what kind of twists and turns you've taken, and also definitely your connections with different types of public sector entities, which I think was very interesting for all of the participants. So just for everybody who's online, we're going to be sharing the presentations with you, as well as all of the contacts of people here who were presenting. I know we got a couple of inquiries of how these presenters can actually present to other governments or other UNDP offices as well. So I think that's very exciting. And just to take a page out of SGInnovate's book, I would like to take a photo of all the panelists. So if I can ask everyone to turn on their cameras, even those of you who have been supporting behind the scenes and haven't spoken yet. So to Pakshi Hanbin, Wayman, Tuan, and Gary, who are instrumental in getting this webinar up and running. If you don't mind turning on your cameras, and then we'll just take a quick screenshot. Thank you so much. So Hanbin, Tuan, and Wayman, maybe we'll go without you here. All right, thanks everyone. Great, and then we'll do one more. All right, thank you all. Thanks everyone, and we will send around the presentations and